Hey there, and welcome back to the Food Solution Summit. I'm your host, Mary Sheila, and today I have the pleasure of interviewing my teacher and functional medicine doctor, Terry Wahls, a professor at the University of Iowa, where she conducts clinical trials testing the efficacy of diet and lifestyle to treat multiple sclerosis, and is the author of the Wahls Protocol. She's also my teacher as a Wahls certified health practitioner and is extremely inspiring to me. Be sure to grab her free gift, her guide to better health behaviors that will give you the specific actionable steps she walks her patients through in her practice and in her clinical trials. And without further ado, let me introduce Dr. Wahls to you. All right, welcome back everybody, and welcome Dr. Wahls. It's such a pleasure to have you. Thank you so much for being part of this summit.
Well, thank you.
Yeah. So I just want to say, first of all, I'm so grateful that you're here, and you are my teacher, and many of the people who are in this community already know I talk a lot about you, and just I have so much respect for your journey and your teachings, and so it's great to have you. And one thing I wanted to say that I always think of is I think I'm like one of Dr. Wahls' biggest fans, and then I meet the people in your community who have completely also transformed their health. And then I know I have some competition because I mean, you really have helped people turn things around. And, you know, you have multiple sclerosis and trigeminal neuralgia. Tell me a little bit about your story and how you overcame that.
Well, we'll take it back. You and your tribe 20 years ago, I'm out walking with my wife. My left leg becomes weak, dragging it home. And see the neurologist the next day, who says, you know, Terry, this could be bad or really, really bad. And, you know, I get the emergency MRI, goes, okay, we don't have to hospitalize you, but go home and we'll start the workup. So at night, laying in bed next to Jackie, I'm thinking about the electrical face pains, the trigeminal neuralgia. It starts here, goes down my face, that I've been having for 20 years. And I've been getting relentlessly worse, despite seeing, you know, the best people, the pain service. And so actually I'm praying for a fatal diagnosis because I don't want to become a burden. 3 weeks later, I hear multiple sclerosis. I see the best people, the best MS centers in the country. I take the newest drugs. And 3 years later, I hear tilt, recline, wheelchair. We up the aggressiveness of my treatment. I take mitoxantrone, a form of chemotherapy. Does not help. I take the new biologic drug, Tysabri. We're so excited. Does not help. My trigeminal neuralgia is worse and worse. It turns on. Tears stream down my face. My 10-year-old daughter, Zeb, hugs me. But, you know, I am a physician. And so am I really doing all that I can? I can at least be reading and studying. So I go to PubMed. I read the basic science. And I begin to develop theories that mitochondria and mitochondrial insufficiency is what drives the relentless degeneration, the relentless progression of disability in MS. And I might add, no one else is talking about that theory. But, you know, I'm looking for drugs that help mitochondria, and I'm like, well, you know, that's not going to go anywhere. So then I turn to supplement studies, and I create a supplement cocktail that does slow the decline. In 2007, I am too weak to sit up at my desk. I'm beginning to have brain fog. I've been reassigned to a new job that I'll have to do in January that when it's described to me, I know full well I cannot do. And so my chief of staff is put in a position where I'll be forced to take medical retirement. But at that time, I discovered a study using electrical stimulation of muscles. And I asked my physical therapist, can I try that? He calls it e-stim. He does give me a test session, and it's really bad. But when it's over, I feel great. He says it's the endorphins. And I come back to clinic every day for the next 2 weeks to get another session. And at the end of the 2 weeks, it says, I'll get you a homegoing small device. And we'll have you add it to your physical therapy. And mind you, all I can do, these tiny little workouts, because if I do more than 10 minutes, I am too exhausted to go to work. I have a zero gravity chair at work where my knees are higher than my nose. And that's how I staff clinic for the residents. I have one at home. I'm doing my E-stim. I'm doing the paleo diet that I've been doing for 5 years. And it's so clear to me that I will likely become bedridden, demented, and my trigeminal neuralgia is going to turn permanently on with electrical pain in response to light, sound, a breeze, touch, swallowing, speaking. And then I discovered the Institute for Functional Medicine. I take the course on neuroprotection. I have more supplements. And then I have a really big aha. Like, what if I redesign my diet, restructure my paleo diet based on the basic science I've been reading, based on mitochondria, based on what I've learned in functional medicine? So that's more research. And now I'm focused on what to eat, as opposed to what not to eat. And I start that way of eating December 26th, 2007. January 1, I go to my new job, the Traumatic Brain Injury Clinic, in my tilt recline wheelchair. And the first 2 weeks, I just get to watch my partners do what they do. And then the third week, I'm supposed to start seeing the patients. At the end of the first day, I'm like, well, it wasn't too bad. At the end of the week, I'm like, I think I can do this. At the end of January, it is clear that my pain is less, my mental clarity is improved, my fatigue is less. And my physical therapist says, Terry, you are getting stronger. I'm advancing your exercises. And in another 2 months, I am walking with a cane. And then another month without the cane. And that spring, I asked Jack, do you think I could ride my bike again? And she says, if things keep going well, maybe in the fall. A couple weeks later, on Mother's Day, I ask again. We have an emergency family meeting. And Jack says, okay, Zach will run along on the left, Zeb will run along on the right, and I'll follow. I push off, and I bike around the block. Zach is crying, Sebby's crying, Jackie's crying, I'm crying. And of course, you can tell I still cry telling that story, because that is when I understood that the current understanding of multiple sclerosis is incomplete. That the current understanding of secondary progressive multiple sclerosis is incomplete. Because my physicians had said, functions once lost will never return, which is why I was willing to be so aggressive with the drug therapy. 3 months later, I do an 18.5 mile bike ride. Once again, we're all crying, my son, my daughter, my wife, and me. It changes how I think about disease and health. It will change the way I practice medicine, and it will change the focus of my research. And that, and now I teach clinicians how to think the way I do, how to practice the way I do, and I teach patients how to use these concepts to stabilize and reverse their autoimmune conditions.
Wow, such a powerful story. And I love that. And 18 miles, 3 months later, I'm a cyclist, so that's a pretty long ride.
And I was tired, mind you. I was certainly tired at the end. I had to take several breaks. And when I started, it's like, okay, however far I get, we'll be fine. So, I'd pedal, 5 miles, then I lay down in the grass a little bit, then I get up and I'd pedal another 5 miles, lay down in the grass. And, I was slow, but I finished. And I was tired. and exhilarated, like, oh my God. So how close to normal, how close to fully recovered can I get? And of course, my kids laugh and say, "No, Terry, Mom, you're never going to be normal. That's just not who you are." Like, okay, well, that is true.
Yeah. You know, what I love too is, so it's funny because right around 2007 is when I started nutrition school. Or maybe I was finishing in those years. But anyways, so many people that enter into the field of nutrition, it's because they have a story. Like they found, like for me too, like I had the standard American diet, tons of antibiotics, lots of fatigue, yeast and bull. And then I moved to an area where there was a lot of agriculture. And I was like, okay, these are my people, and I started getting into gardening and farming and cooking. And all of a sudden it was like, wait, I feel so much better. And so when a physician has that same, you had to completely revamp everything you knew about food.
Correct. And I've always enjoyed cooking. I'd been a low-fat vegetarian, very low-fat vegetarian for 20 years, doing, what everyone would say is a really fabulous diet that looked very much like a Mediterranean diet, only it was lower in fat. And for me, it accelerated my disease.
Right. Right. Yeah. And that's part of the whole, I think, just with nutrition is there's often not just one right way, but there's so much, kind of misinformation and on in so many levels, in so many ways.
If we think about how our species originated, Central Africa, and we separate from primates 6 million years ago, then the genus Homo 2 million years ago, and then Homo sapiens 250,000 years ago. We migrate to Northern Africa, then we have to have a 100,000-year war with the Neanderthals. We either exterminate them or assimilate them, and then we expand to Northern Europe, the Arctic, Asia, Australia, Pacific Islands, North and South America. So we've had reproductive success in a wide variety of ecosystems, eating a wide variety of foodstuffs. Agriculture is relatively recent, 10,000 years, and we still had reproductive success. We're pretty healthy. But in the last 75 years, we've radically transformed what we eat. And the experience is it's not had good impact on our health.
Yeah, exactly. And, one of the things actually in one of the calls, because you're my teacher, and one of the calls that we had that really resonated for me. And I think for when people are starting to eat healthier and cook more, but then there's also like, oh, I have to cook again or whatever. And one of the things we talked about that you mentioned is, sometimes you can make something and you can just have that be your meal a couple times a day, because think about our ancestors. They harvested, or maybe they made their kill, and that's what they ate.
That's what they ate until it was gone.
Yeah, exactly.
So that's what you ate until it was gone. And then okay, we got to go out again. And we go make our next harvest. So we would go through periods of plentiful food, we'd run out, then we would have to exert a whole lot of calories to go hunt and gather. The women, we'd use nets. And so we were actually very effective hunters. The men would go longer, bigger game, carry it back. So they've got a 9 to 10 mile range. And a lot of weight that they're carrying back. And the compact between women and men was, we'll cook, you'll protect us. And so the women cooked, the men ate first, then we ate, and we sort of watched the kids. And there's actually a lot more leisure time in the hunter-gatherer society, small clans, but immense diversity, immense seasonality. It's all local. And you had a lot of physical activity, getting that food, preparing that food, And then there was a lot of social bonding and meaning and purpose in the tasks at hand. So it's certainly a different way of living. I tell my tribe, if we can sort of think about the way I would structure my day to be better aligned with the way my DNA evolved, which was intermittent hard work with rest, intermittent access to food, and then less access to food, outside, meaningful work, and social relationships. That will create healthier physiology for you. And as you have healthier physiology, less inflammation, less oxidative stress, a lot of the drivers of the autoimmune process get unwound and the disease becomes less active. And your physician says, well, whatever you're doing, keep it up because, man, everything's looking great here. And then after a few years of that, my patients say, often to their specialist, I want to transition to a less potent drug or potentially off of drugs, and then just be watched closely. Of course, it depends on the individual, but time and time again, our tribe stabilizes their disease, regress their disease, their laboratory evaluation of disease activity continues to go down, down, down. The quality of life goes up, up, up. And their physicians are like, what is it you're doing again?
Yeah, you want them to ask that other question. You don't want to just say, keep doing what you're doing. Like, wait, what are you doing? So I can, start to look at this and learn and tell other of my patients that are in this situation that you're in.
It's hard for us to change our understanding of the world. So when I first changed my clinical practice at the VA, I'm teaching the residents biochemistry, and they think I'm talking about the latest drug, but I'm talking about broccoli and turmeric, and I'm talking to the vets about diet and food, and having great success with guests to change their diets and really have much more dramatic impacts on the health. But some of my physician colleagues and nursing colleagues were like, you're not practicing standard of care. So I had to go meet with my chief of staff and said, Terry, what's going on? I'm getting all sorts of complaints about you. Not from patients, from practitioners. Right. So I had been prepared for that. I brought with me my stack of papers. I went through them, and unfortunately, I won him over. And he's like, okay, just keep in mind, if anyone gets hurt, you'll go through peer reviews. Yeah, of course. That's what we do always. Of course, no one ever got hurt. And eventually, I was pulled out of primary care because I was so successful. The chief of medicine, the chief of the hospital, the chief, the chief of staff said, we want you to have your own clinic so you can take the toughest cases. So I went to specialty medicine. I went to the pain service. I went to primary care and said, I want your people that you can't help, but you're going to keep managing their drugs. I will talk with them about diet and lifestyle. And ultimately, that clinic was so successful. We had to keep redesigning the clinic from small group visits, because I was always too busy to have one-on-one patients. So we had small group visits, then larger group visits, then classes, and then after 3 years of it, I hired more staff, and then I made the decision to retire from the VA so I could spend more time teaching what I do to other clinicians around the globe, and to run more group classes for patients. Yeah. So patients could likewise begin to have these transformations.
That's awesome. Yeah, I love the group classes. That's something I've been doing for a long time. And, and one of the couple of things I want to say is, one is just that I love that you really went against the grain and you were able to conduct research studies with food as medicine rather than drugs, which is really hard to do.
Yeah. So, my chief of medicine at the university is a rheumatologist. So when I went in for my every 2-year review, I walked in and he hadn't seen me, since I'd been in the reclining wheelchair. So he's like, "Oh my God. So you must be taking Tysabri." I said, "Well, no, actually," and I explained everything that I was doing. So he said, "Okay, so here's your assignment. Get a case report written on yourself, with your treating physician and your physical therapist." So we did that. Then he called me back, and I was so proud that we got that report published. And he said, "Now I want you to do a safety and feasibility trial to see if others with progressive MS will do what you have done. And if they will, do you hurt anyone? Is it safe? And what's the effect size?" So we did that little study. We showed that, yep, even profoundly disabled folks who are, cane and walkers could do what I had done. And that their fatigue went down, their quality of life was remarkably improved, their verbal and nonverbal reasoning, thinking was remarkably improved. And now here's the other thing that is stunning. In progressive MS, you don't anticipate anyone's gait or motor function to improve. That's the nature of the disease. Half of our folks had improved their gait and their hand function. Stunning. As a group, they stayed flat. Well, also stunning because you expect a 10-20% decline every year. So then we started doing randomized studies. Then we started studying just the diet. So we did several studies that way, again, showing people could do this, that modified paleo diet, which is basically the Wahls diet, has much better outcomes than the usual diet. Then we did a study comparing Wahls in low saturated fat or SWANK. We had an observation period. Then we randomized where we did assessments at the beginning and at 12 weeks to show how stable all those assessments were. Then we randomized them to low fat or Wahls and repeat the assessments at 12 and 24 weeks. And again, we show that, it's interesting, both Wahls and SWANK were helpful for fatigue. On some more sensitive measures, Wahls was more helpful. Both diets helped with quality of life. Wahls more than SWANK, but they both were still helpful. And the working memory was equivalent in both groups, but it did improve. In walking endurance, interesting enough, improved for the Wahls group at 24 weeks.
Yeah, that's
food is profound. Food is just so profound.
Yep. One of the things, like when I talk to my clients, and I work at a medical clinic part-time, and one of my mottos has been, and I want to talk to you about this a little bit, is 80-20. And sometimes it's maybe 85-15, and then sometimes it's 100%. And I know that, because I always have to meet people just like you where they're at. It's like, okay, at least do it the best that you can, and cut yourself some slack when you fall back into certain patterns and habits. And then, you just got to get back up and keep trying. But you are, like 100% because
100
you
days
have to be. So let's just talk about that.
So in my clinics at the VA, people would get referred to the lifestyle clinic. We'd have a big group class that they'd come with them and their significant other. I'd tell my story, stories of some other patients, would explain a little bit about functional medicine, the microbiome, oxidative stress, the mitochondria, hormones, and say, okay, we're going to address the root cause. Now, if you want to work all in with me, come through the individual evaluation, the group calls and support that we'll have for 6 months, I need a commitment that you're 100% in, you and your family, for 100 days. If that feels too difficult, and this may be not the right time for you, maybe you've got a big work project, your spouse has some major issues, you're dealing with difficult children. So if it's not the right time, that's okay. Or you might be telling me that I'm much more interested in physical activity. So I'll work on my physical activity. I'm not ready to do diet. Then we'll send you to physical therapy. Or you might tell me, I can't do physical activity or diet, but I could do stress reduction. We'll send you to the psychologist to work on a meditative practice. Or you might be telling me, I can work on improving my diet, but I have to do it more gradually. That's fine. We'll send you to the dietitian. So people had options to say, I'm all in 100%, 100 days. I want to begin with either movement or stress reduction or gradually improving the diet. And then there'd be individual referrals. Or they could say, this is too hard. I have too many other things in my life. It's not the right time. So I never convince people. I just tell the story, tell the mechanisms. We have beautiful metaphors. And then I say, here are your entry points. You get be 100% all in, come to our group classes. They're lots of fun. You can begin to explore movement, stress reduction, or working on your diet with an individual consult. Or you can decide this is not the right time for you, and then ask to come back when it is. That way, the people that I'm working with are ready to do what's assigned, because I want people to experience success. So they have to be willing to do the interventions at 100%. If you do it at 50%, you have no idea if the intervention worked.
Right. And one of the things that you've really identified, and just, especially all around autoimmune, is that there are foods that are such big triggers for the immune system, and they start to damage whatever, part of the autoimmune process. And, you can't always, that damage isn't always going to be healed. So it's like, it's not worth it, right? It's not worth it to eat some bread or some gluten, or maybe you don't know what's in that food, right?
Correct. And it may be a process to getting to being willing to do the elimination diet to really identify which foods are problematic. And initially, I was very dogmatic. If you want to work with us, my team, you got to be 100%. And then as I realized I should give people the entry points to movement or stress reduction, that for some folks, they have to get the physiology a little less reactive so they can have the emotional energy to address diet. Because addressing your diet will be key. I much prefer that people do it first.
Right.
But everyone is unique. And for some, that's not the right time to work on diet. They're going to have to do stress reduction or exercise. But if they want to fully recover, they'll end up coming back. And then we'll finally help them. Now that they're slightly less reactive, they're in a better place to do the cooking, do the exploration, give up the foods that'll be so problematic, the sugar, the gluten, the dairy. And then for some, we may be more restrictive as well.
Right. And the whole goal is to really identify exactly what those foods are, and really go
so
ahead.
in the VA, the people that I saw were typically disabled, living on food stamps, had limited energy, and we're shopping in small town grocery stores in rural Iowa, Missouri, Illinois. So I'm working with folks who have limited resources, limited energy, and we're extraordinarily successful. I'll also tell you that because I was in the VA, I couldn't do any fancy functional medicine labs. I could do, primary care kinds of labs. And at first I was sort of annoyed about that. On the other hand, because I've been working in the traumatic brain injury clinic where I could order no labs for 3 years, this also felt incredibly luxurious. Like, okay, now I can order a vitamin D, a glucose, an insulin, homocysteine levels, and fasting lipids. And so that was my very luxurious laboratory panel I was doing for these patients. And I could create inspiration, hope, possibility. And we could use that information to dial in their diet and to help them get, because often, very often, these folks had elevated insulins. They weren't yet diabetic. Their primary care doc wasn't talking about the fact that their hemoglobin A1C was 7 or 8, pardon me, 5.7 or 5.8.
Mm-hmm.
And so I'm like, okay, well, you actually have criteria for metabolic syndrome here. So we should address that while you're in our program. And of course, our program was very successful at helping people get their hemoglobin A1Cs back down to 5.4, 5.2, and their lipids improving, their weights improving, and then their medical symptoms questionnaire score, which is really a very detailed review of systems, improves as well. So you don't need to have complicated labs to have a profound impact.
Yeah, especially, I think for the Wahls protocol, which is the diet or the diet that you developed that supported you and supported so many of your patients to have recoveries, your focus is, I would say, nutrient density, and then also on the quality and health of fats, and when we're talking about, the nervous system and the myelin sheath, and also just the cell membranes made of fat, it is such a critical point, and it's often so, overlooked and so easy to get the wrong kinds if we're, buying a salad dressing from the store or a dip or whatever,
Yeah, in personal care products,
Yeah.
people put it on their skin, often have a lot of undesirable toxins that you'll absorb through your skin as well. And people will use cooking oil. And the fast food uses all this cooking oil that will increase the intake of trans fats. And the trans fats are incredibly inflammatory and damaging to your myelin, to your cell membranes, increase the risk of metabolic syndrome, of heart disease, of anxiety, depression, cancers, and autoimmunity.
Yeah.
So,
and then, go ahead.
So I would much rather people use, if you are going to fry, use a animal fat. But I'm really not that fond of frying. I'd rather people boil, steam, braise, roast, and then take a high quality olive oil mixed with your favorite herbs to make a lovely pesto or chimichurri, and pour that over your vegetables, your meat. Like, oh my God, it is so delicious.
Yeah, you're talking my language. Absolutely. And the other hallmark and for your diet is like the 9 cups of vegetables every day.
Oh, yeah. So, well, let me explain the story behind that. So, when I first am redoing my diet, I have the list of all these key nutrients, the key foods I should be eating. It's sort of complicated.
Yeah.
But I'm feeling great, and now I want to teach my vets, and I'm like, okay, I got to make this simpler for them so I can teach this because I don't have that much time. So now I'm looking at my food list, what I'm eating, and how to convey the message. Plus, I also need my vets to not be hungry, so they won't be tempted to make bad decisions. And so that's how I got it organized at a really basic level. 9 cups of greens, green leafy vegetables, 9 cups in the cabbage family, right? In the cabbage, onion, mushroom family. And that, pardon me, it's 3 cups of greens, 3 cups of the cabbage, onion, mushroom family, and 3 cups of deeply colored like beets, carrots, berries. And so it's okay, so that's 9 cups. And my vets would say, okay, is that a month or a week? Yeah. and we'd laugh. They said, no, that's a day. So, oh, I know, Doc, I'm just pulling your leg. And so in my clinical practice, where I may have a very petite female or even a very petite man, and I'm saying, okay, 2 palm-sized servings of meat if you're a meat eater, and greens, sulfur-rich, and color proportionately according to your appetite. And so you might be petite enough that it's 6 cups or 5 cups. So I'm not trying to have you overconsume. I just don't think you have to be hungry.
Yeah. Well, and I love it. And what I usually say, because when I hear 9 cups a day, it's sort of, if I think about it from, just anybody's perspective, I'd be like, kind of feel overwhelmed. So what I've always taught people, and then when I learned, your methodology, I was like, okay, this is exactly kind of what I've been teaching people, is I always use the hands and I say, okay, what's your protein? And then, the starch, which can be optional. And then half of your plate is your greens. And so 2 to 4 servings at a meal. And that is going to add up right up to 9 if you're eating 3 meals,
I think a visual cue like that is really helpful for patients. And of course, I have an international audience and they're like, we don't use cups, use grams.
Right.
And I'm like, okay, use your hands.
Exactly.
And then you could use your dinner plate. And so if you think about 3/4 of your dinner plate, I want to be vegetables, and 1/4 of it is your protein. Then you have as many dinner plates as you feel like having.
Right. And you do a lot of intermittent fasting, and, and then the other thing just around intermittent fasting, that's very metabolically supportive, and just even the foundation of, having balanced meals like that really helps to stabilize blood sugar, which is very foundational because, you mentioned that high A1C, that can be very inflammatory, right?
Now, let me talk a little bit about that. So we have an epidemic of worsening blood sugar control across the country. And that means we have an epidemic of people with high blood pressure, obesity, high triglycerides, low HDL. And so they are at risk of having a metabolic syndrome. If you have metabolic syndrome, then you have worse outcomes for heart disease, for diabetes, for cognition, and for any of the autoimmune conditions and any of the mental health problems. If your blood sugar is creeping upward, you have worse outcomes if you have a viral infection, whether it's the influenza or the SARS-CoV-2 or pneumonia. It's certainly in my practice and with my tribe, I tell everyone, you need to know your blood sugar and your insulin, and you need to know how many risk factors you have for metabolic syndrome, and get your blood sugar and your insulin under control, and get all of the risk factors for metabolic syndrome under control so we can regress that. Because it is, think of it as a accelerant to the fire that is destroying your health. It is an accelerant that's largely under our control by the way we live and the way we choose to eat.
Absolutely. And I think the more you emphasize those, especially those bitters and the greens and, even the colorful fruits and vegetables, that's when you really transform your taste buds and you don't have as many of those cravings.
Yeah, I explained to everyone that culturally, all of our children learn to eat their culturally familiar diet. And so if we introduce foods to children, it's about 10 to 30 times before they have assimilated that new taste. And it tastes good to them. As adults, I want people, taste new foods, realize that it'll take you maybe 20 to 30 times to get comfortable with it. I also talk about how important bitter is, and that we can make bitter delicious by adding more fat and adding some acid that lowers the pH. And the other thing is really helpful because bitters stimulate your digestive secretions, is to have a little bit of kale or dandelion and chew it before your meal. take a few moments, chew, get that bitter flavor going. It's going to stimulate your digestive enzymes. You'll have more effective digestion. And if you'll begin to do that, I predict that your enjoyment of that bitter flavor will evolve. Because I ask people, did you enjoy coffee? Well, yeah, I said, that was an acquired taste. Do you enjoy beer? Well, yeah, that was an acquired taste. Do you enjoy wine? Well, yeah, that is an acquired taste. And these foods have, a variety of properties that may be helpful or harmful to us, but they're all an acquired taste. The tastes that are not acquired that we like from birth is breast milk. What's in breast milk?
Sweet.
It's very sweet and it's very high in fat. So our food industry has learned that if we can manufacture food that has that primal desire to us, sweet and fat, we will overconsume it. It's also why vanilla ice cream is so delicious to so many people, because it is so similar in many ways to breast milk.
Mm-hmm. Absolutely. Yep. Well, I just want to say right here, I just want to say thank you so much. And I also want to say that you have something that people can download and then, follow you. You also have some upcoming events on the weekends. That's when I first got started actually with you. I was supposed to go to Iowa, which I was so excited about, but I had a whole road trip planned, but I did online with you for about 4 months, I think, which was amazing to see the transformation that people in the group had and just to fit it into my life. So I know you have some upcoming weekends, and so go check out Dr. Wahls' website, but also you have a freebie, which is your better health behaviors. Can you just tell us a little bit about that?
Well, the root of our health is learning how to make these changes. How do we motivate ourselves to make these dietary changes? Or if I've decided I want to do the meditation program or the movement program, in that first decision is how we grow your internal motivation to experience the discomfort and to begin incrementally to make these small steps. The better health is that the guidance that we give in our clinics to help people step by step be more successful with creating the habit that they've chosen that they want to create, whether it is meditation, adding bitters, adding exercise. There's a process. And so I think your audience will find that incredibly helpful.
Awesome. Yes. Well, thank you so much for being here and sharing your story. I love hearing your story, and just you're so inspiring to know that food is truly medicine. You can change, you can heal, and you can get back on your bike and ride 18 miles. You've run a lot more since then. Yeah, thank you.